So I was sure that I wanted to be a doctor. I was sure of it. And as a student at Stanford in 2007, I volunteered at a hospital in rural Malawi. And I took on listening as my most important mission and began to understand some difficult realities. There was just one doctor at the hospital, and he was responsible for 250,000 people. Patients and their families were walking or ox carting up to 100 miles to get to the hospital's doorsteps. Fortunately, there was more to the story. Hundreds of community health volunteers had pledged to look after patients in their communities with basic drug kits and some basic training. But they were out in the communities, and all that I saw was the burden at the hospital. Then I met Dixon Tanga, and I'm excited for you to meet him too. He was one of the volunteers. And once every week, Dixon was walking 35 miles to the hospital from his home to update the nurse on patients in his community. He was determined to bridge the gap no matter how many hours it took. One evening, I visited Dixon at his house, and I looked down at my phone, and I had 6 bars of cell phone coverage. Much better coverage than back at Stanford. Dixon and I sat down, and we decided to change how he was communicating with the hospital. I flew back to Stanford and raised a few $1,000s from the Center for Public Service, and then I met Ken Banks, who was literally living out of a van on the edge of campus, creating some software that would let me manage messaging with hundreds of contacts using a simple laptop. I packed a suitcase full of cell phones. I scratched ID numbers on the faceplates using my grandfather's old engraver, and I somehow made it back to Malawi with a backpack full of cell phones through security. Wouldn't happen today. 75 of these health volunteers, including Dixon, came together for text message training. My mother and my sister were there to help. And with the new system in place, medical teams were responding to emergency requests for help for the first time ever. And if a patient missed an appointment, the hospital found out why and made sure the patient stayed in care. Tuberculosis symptoms came streaming in by text message, and in 6 months, the number of people being treated for TB at the hospital had doubled. Thanks. So we created an organization called Medic Mobile to expand this impact. And since 2009, we've helped an additional 10,000 frontline health workers across 20 countries. And today, our programs reach 6 million people. It'll be 9 million by the end of the year. And we've seen success. So we've seen childhood immunization rates increase from 60% to 99% because of a text messaging system in India. Stockouts and disease outbreaks are now tracked 134 times faster in Kenya and in Malawi. After the earthquake in 2010 in Haiti, we saw that it was possible to manage 100,000 requests for help by text message. So we've seen firsthand that technologies can be harnessed for global health. For example, we needed to run healthcare applications on the simplest cell phones common in every community, and we found a solution online, of all places, a parallel SIM card that has mostly been used to jailbreak iPhones. We now have a small computer that's thin enough to fit underneath existing SIM cards and lets us run our apps on any phone. Another example, last year I met an engineer named Nithya who was developing a low-cost temperature monitor that plugs into the headphone jack of cell phones. We knew that monitoring cold chain for vaccines was a huge challenge, especially in rural areas, where nearly 1 in 5 vaccines are exposed to unsafe temperatures. We decided to experiment by putting sensors in vaccine boxes in rural Kenya, and we designed a communication system for the local health workers. In just 1 month this year, thousands of vials of vaccines were saved following text message alerts. So it's clear that we have new tools. Thanks. So it's really clear we have new tools for our work improving health in challenging settings. And this is important because there are troubling statistics that tell a story we cannot bear. In 10 countries, 1 in 4 children will die before reaching age 5. 1 million children die every year on the day that they're born. We are actively competing with an unjust state of affairs, and global health equity is worth a long fight. I know that technology can serve justice and improve lives in a sustainable way. Our approach is both more effective and 4 times cheaper than current systems, and that first system in Malawi has been managed locally for over 5 years, and they continue to save costs by using text messaging instead of motorcycle fuel. So I'm proud to say that empathy, experimentation, and grit come second nature to you all and to our generation. We are working towards a future with equitable distribution of health services, saving costs, saving lives, and improving the human condition. And this final message is really for every single person in this room, that your talents are immediately needed. Do not wait for good news, go out and create it. Thank you very much.